Hi guys, this is Jacqui Cooper from JCooperTravels, and I want to welcome everyone today. We are talking about a topic that is, I wouldn't say near and dear to our heart, but it's kind of practical. It's definitely COVID related, it's definitely travel related, and it's definitely personal. So I have Dr. Brown here, but before I have her introduce herself, we're doing continuing conversations. For those that are just new to my podcast, J Cooper Travels, I sort of am in the process of rebranding because when I first started J Cooper Travels, I was all about travel, which I still am, hence the picture behind. But I also know that with my connections on LinkedIn and other social platforms that I've been meeting really fascinating people, and I wanted to share their stories with everyone. So J Cooper Travels is really about personal stories of how we travel in life, through our own careers, through our own personal life, as well as where we go. And every New Year's, we always have resolutions. So J. Cooper Travels is all about how do we achieve, our resolutions for the year. And that year starts every new day that we are able to enjoy. So with that being said, Dr. Brown, thank you so much for being here. You have spoken on our podcast about various topics before. We've talked about the COVID vaccine, we've talked about exercise, we've talked about diabetes, we have talked about the autoimmune situation, sometimes that some individuals have had. We've talked about inflammation. I mean, the conversations keep going on. And for those that are also listening, Wednesday is Wellness Wednesdays. And so I'll be posting Dr. Brown's conversations and tips with all my listeners and followers on Wednesdays, because we all want to stay well so we can travel both long distance as well as locally. Today's topic is about what, Dr. Brown?
It's about mask wearing.
Mask wearing. So why don't you share a little bit more about your story for those that might not have had the pleasure of listening to our past podcasts?
Yes, my name is Dr. Tiffany Brown. I'm a naturopathic doctor. And how I got here is I had women's health issues, and I was going from doctor to doctor. They was doing what they were supposed to be doing, but I just wasn't seeing any relief. So I just looked off into the natural world to see what they were doing to help with their symptoms, and it was overwhelming. So I just tried one thing, saw some relief, but I know I didn't hadn't fixed the situation. So I was looking for naturopathic doctors in my area, holistic doctors in my area, and there was none. So I was like, okay, I can do this. I can go to school and become a naturopathic doctor. So 4 years later, here I am. I got an online website that I can see people from anywhere and give recommendations to help them as well, help other people as well.
Yep. And the
Mhm.
website is ndhealthcalls.com. So we're going to be talking about masks. Now, I had seen many years ago individuals wearing masks, and I didn't even think twice about it. I thought, well, I would probably not wear a mask, but I didn't think about the purpose and the reason for wearing a mask.
Mhm.
So, why should we be wearing masks? What does the CDC say about masks? Share a little bit more about that.
Okay, the CDC is saying that we should wear masks to avoid the drop aerosol droplets that's coming from like our mouths of us and the people whose mouths we're talking to, because aerosol droplets can come when we're talking, coughing, yelling, sneezing, anything that allows us to open our mouth. We might spew some aerosol droplets to somebody else, and so they saying they want us to start wearing a mask to it'll help prevent the spread of this COVID coronavirus right now.
So, does it matter? Why are they saying how far away? 6 feet. Why are they saying that?
Yeah.
Does the
Mhm.
distance matter?
Yes. So the mask can only protect you for so much, but the masks aren't 100%. So with the mask, they want you in addition to do 6 feet. So when you're talking and each other, the aerosol drops are coming out. The mask gonna catch some of it, but whatever the mask don't catch, then hopefully with the 6 feet distance between you, it dissipates there in between that area.
So what about the age of a mask,
Mhm.
of the person wearing the mask?
Yeah, so they want everybody that's 2 and up to wear a mask, and then people like this not in your household. If you have guests over, they want you all to have a mask on. If you go out in public and you in close distance with people, they want you to wear a mask. So most definitely put your mask on just to stop the spread. And the CDC lists a couple of people who maybe don't have to wear the mask, but it also lists what you can do, I guess, to help these people. Because some people who have like cognitive disabilities or behavioral disabilities, or people who has difficulty breathing, um, if you under 2 years old, you don't have to wear a mask. And people who's incapacitated or unconscious, you know, you just have to take their mask off so they can, make sure they get some air in.
So what does the research say about masks?
Mhm. Yeah. So the research is saying that, like, I looked at the research for this year, and a lot of the research has pulled research from previous years where they have done research on masks, and they're saying they're effective up to 1%, up to a certain point. So and that's the reason, and they're confirming that you want to do the 6 feet away, and you want to hand sanitize and or wash your hands to if you touch your mask a lot, because it's where your pathogens can accumulate on your mask. And then also they're saying that, they want your mask to have a tight fit around your nose and your mouth. Like the mask can't be here. This isn't good. This should be here. And you shouldn't have no gap here or here or here, no gaps. Because once you get that gap in there, that's when it's less effective. So so you want to make sure you know buy one that fits really nice. And then they were saying the cotton mask, like for like this is cotton, you want it densely, you want dense fibers. You don't want the one you can hold up to the light and you can look through, because that's kind of ineffective also. So the thicker the material is, the better. But then you got to watch out, because then it's a little harder for you to breathe and things like that. So you have to take all that in consideration.
So what I was always wondering about is how do you keep your mask clean? I mean,
Mhm.
should you how often should you be changing your mask?
Mhm. So those paper surgical masks, they just a one-time use. So I see people wearing those like over and over. This is a one-time use thing. So as when you get the cotton mask, and you want to wash those. Like you wear it one time, you want to bring them home, wash them in detergent, warm water, dry them, and then they say store it in a paper bag until you're ready to use it, because it keeps it clean. And the CDC also said that you should have 2 masks with you. So if you get one dirty, you automatically have another one to put on.
That makes sense. So how often should you clean your mask?
After every use, if you go out and then you come back in, you want to clean it and have another one ready just in case you have to go back out. Because the more you touch this, especially right here, the pathogens are here. And then you touch it and we don't think about it, and next thing you touch our face, or we eating or something and touching other things. so, so and then, like they said, the coronavirus can stay in aerosol droplets for 3 hours. And let me look. And like it says on cardboard for so many hours, for up to 24 hours on cardboard. Stainless steel, it stays on stainless steel for 48 hours. And plastic, the coronavirus stays on there for 72 hours. So you got to realize, when you touch this, and then you touching other things, and then you're not washing your hands properly, and then we wonder kind of how we, can get the coronavirus. So it's
So would it be advisable to have like hand sanitizer right in the front of your door when you come back to immediately clean your hands? Or I'm just trying to think. I know when we first, were in lockdown,
Mhm.
I know I was a lot more diligent in trying to
Mhm.
think about, now that we've been around, this concept for a while, I think people are getting a little bit more casual.
Yeah.
What would you suggest to as a good routine
Mhm.
from car to house to
Mhm.
hand
Yeah.
cleansing? What are your thoughts?
Yeah. So what I do is when I first, like if I'm going to the store, my mask, I put it on before I leave home. So then because I know it's clean. And then when I get to the store, I grab it here, pull it up and put it on, straighten up, pull it on, make sure there's no feet, no gaps or anything. And I always have hand sanitizer like in my purse or in my pocket. And I go in the store, do my shopping. When I come out, I use it then, or if I get as soon as I get in my car, I use it then. And then I drive home. And then like after I put my groceries up, the things I can wipe down, I wipe down. And whatever I can't, I just have to set it to the side for a little while, for a couple of hours or something. And you have to be mindful because you don't want to get relaxed. This is not the time to get relaxed.
Yeah, no, it's not. So what about if you have respiratory conditions?
Mhm.
Or what would you recommend for that?
So the CDC says that people who have like asthma, they could wear a mask, but people who have COPD, they are kind of really don't want them to wear a mask because they already compromised in their breathing. So they don't want them to wear a mask. So, and most of those probably don't go out either. So if you do go out, you most definitely want to consult your doctor to really confirm that if that's really okay. Mm.
Well, anything else that you can think of? You really have covered everything from the A to the Z's of mask wearing. I guess, my takeaway is definitely have more than one mask. So
Yes.
that way you can switch it out. Also
Mhm.
continue with the hand washing and
Mhm.
making sure that you're wearing your mask when you're outside or near people and keeping your distance so that way you're not exposed.
So true.
Any other last minute thoughts on how to keep safe?
Yeah. So another reason why you want to wear your mask, research was saying that the viral load that's in an asymptomatic patient in the respiratory area of an asymptomatic patient is similar to the viral load in a symptomatic patient. So that's even more reason why you want to. That's because somebody, they're not presenting with any symptoms. You just never know. So if you encounter or around somebody who you've been around, you most definitely want to put your mask on because they could be asymptomatic.
So I mean, this is a whole nother podcast, whole nother topic. I'm wondering for those that are asymptomatic, what within their body chemistry allows them to be not have any symptoms being shown. I mean, that's fascinating to me, frightening in some ways, but also fascinating from the perspective that their body is able to tolerate it, even
Yeah.
though they can transmit it.
Hmm.
So, have they had any sort of research as to, why that is?
Maybe because their immune system might be a little better, and the body is fighting maybe, and they're not really showing the symptoms right then. But usually, even if your immune system is fighting, there's still something that's going to present like a fever or something. And these patients aren't even having that. So we just don't know.
There's a lot to learn, definitely a lot to learn.
Yeah.
Well, I appreciate your being on, and I know we'll have other conversations. Everyone who's listening, definitely check out the link below so that way you can reach out to Dr. Brown at ndhealthcalls.com. The other thing that I will share in the link below is also the information for the YouTube channel, so that way you can like and subscribe so you can watch as well.
Yeah.
And the final thing that I'll share with you is, access to my free travel discount website. So that way, as we start to travel again, you can take
Mhm.
little wellness trips to kind of help with your own rejuvenation, because I think we all need that.
Yes.
So thank you so much, Dr. Brown, for being here. I look forward to talking to you again.
Thank you. Thank you for having me.